out there doing what you're doing, seeing the world you're pursuing. Is there still any room left for me? I'm proud of all that you've accomplished, but girl, if I'm still being honest, I'll be something that you wanna see. You're known throughout all every city. They don't know you like I know you, baby. They don't see what I know is to be. All I ever wanted it was you, girl. Living with you and you are loving on you, baby. 'Cause I know what we got.
Good afternoon. We're going to be starting in about 5 minutes, but I would suggest if perhaps the majority of you that are sitting in the back, if you can move a little bit closer. This is going to be a smaller session, so we want to be a little bit more intimate and be able to interact and have a very active discussion with the panel members. So feel free to move a little closer. Get comfortable. And we're going to start in about 4 minutes. Good afternoon again, everyone. Welcome to the interactive part of our annual healthcare conference. This is an opportunity for you now, in the next 90 minutes, to be able to interact with a panel of experts on the topic Living with Invisible Illnesses. This is coming courtesy of Miami Cancer Institute. Baptist Health South Florida has kindly sponsored this interactive workshop. So this afternoon session, we want to try to achieve some common objectives. We have a cross-sector of many disciplines here on the panel this afternoon, and we want to be able to talk very openly about invisible illnesses. What does it mean to be living with invisible illnesses? We want to talk a little bit about the challenges that we have in diagnosing those invisible illnesses. What are they, of course? As well as some of the nutritional guidance that we may want to give to patients who have some of those illnesses. Advice for family members, friends, even employers, as well as any available support that's out there for some of these illnesses. So, what is an invisible illness? Many of you may have some ideas. Many of you may not have many ideas at all, and you may be drawing a blank. Essentially, an invisible illness are those illnesses that affect you on the inside, that make you feel poorly, but you look perfectly normal on the outside. And hence, there you will have challenges with persons expecting the same sort of reactions and responses and activities from you, but you're actually feeling very poorly on the inside. But before I introduce our panel to talk to us about this topic, I want to just show you a brief video and let you see a group of individuals who are living with an invisible illness called multiple sclerosis.
My name is Alyssa Christian, and I'm the founder and chair of the MS Foundation of the Cayman Islands. I was diagnosed with MS in 2015 officially, but I had had symptoms multiple years leading up to that. So I just lost vision in one eye, the next eye, and then back to the first eye. After I had my first child in 2013, I started experiencing stabbing pains, weakness, balance issues, numbing. At first I was scared, and I was nervous. I didn't know what to expect, what MS really was. I thought my doctor was a little bit crazy at the time. I said, Dr. Foley, I cannot lose my vision. I can't. I'm an artist. My degree's in interior design. Like, that to me is my worst nightmare. And I cried just even thinking about that. And so when it became a reality for me, and Dr. Foley said, well, dear, we don't wish that on anybody. I was like, no, but you don't get it. For me, that's my life. That's everything to me.
My mommy has a foundation that helps people with MS. The people that my mommy helps don't look sick.
99% of the time when you tell somebody you have MS, their response is usually, well, you look so great. And while I know that they mean that in the nicest way possible, it is very frustrating to hear, because what I want them to understand and know is that what's happening on the inside of our bodies is not always reflected outwardly, and it is hard to see. And we even had some local photographers take interpretation photos of MS symptoms such as optic neuritis, dizziness, and present those in an artistic way to help others who don't have MS visualize what those experiences are like.
I have lost track of how many friends and acquaintances I know that have MS now. I can't count, there's so many. It is honestly one of the most excruciating diseases ever, and I think people don't get that. I hope people understand how serious this is, and that when you see somebody that has MS, one day might be good, but the next day might be horrible.
As a doctor, I've seen patients with multiple sclerosis and the suffering they go through, as well as their families, and how difficult and challenging the disease can be, which is why an organization like this is very, very important to have here in the Cayman Islands.
There are a lot of challenges to having MS, physically, emotionally, mentally. Yeah, it's tough. It's not easy.
There's the whole emotional.
Yeah, that's another. Like, it's a roller coaster all in itself.
Yeah, I'll be good one minute, and then like the next minute I'm either sad or I'm upset. Like, I had to call her one day. I couldn't figure out what was wrong with me. I was like, I don't know what happened.
I've had pain in nerve pain, and then I've also had pain that just comes along with having MS, including trigeminal neuralgia, which is pain in your eye. That was one of the diagnosing characteristics for me.
Nerve pain is probably one of the most excruciating feelings that anybody can ever feel. I gained 60 pounds in the first relapse. It was like I was dying. They said that I would be in a wheelchair permanently with someone taking care of me 100%.
It's the basic things in life that we take for granted. It is really challenging for me. Walking, I can trip over, so someone always has to walk with me. I can't go for a walk like I would like to and exercise like I would like to. So things that I used to take for granted is now a challenge for me.
The pain is always there in some way, shape, or form. I've seen her come to grips with her reality, but she still fights daily to try to do the things that she wants to do, so she's a fighter.
Multiple sclerosis is an autoimmune disorder which affects the nervous system, that's the brain and the spinal cord. Currently on island, there are approximately 25 to 30 patients suffering from MS. Worldwide, it's estimated that 2.5 million people have multiple sclerosis. It occurs more commonly in females than it does males. The age group is around the second to third decade of life. Unfortunately, there is no cure for MS. The treatment for MS, the cost of it varies from around $8,000 to around almost $60,000 to $65,000 per year. These are just medications. There's also other tests which are involved, like MRIs, which need to be done every year, so the cost is quite high. There is extensive research going into multiple sclerosis. There are newer drugs coming out and are showing a lot of promise.
Sometimes just having a support system and a group of people that have something similar to what you have and knowing that you're not alone makes a world of difference. I think that's a wonderful thing about the MS Foundation.
Now we have a support group that has begun, so we need this because without that, we don't have anyone really to turn to.
There's a lot that goes on that emotionally, physically, and mentally with MS patients, and the caregivers also need to have support and have a foundation that they can say, I want to meet somebody that's going through what I'm going through.
The ultimate goal is not only to provide the financial and emotional support for MS patients and families, but to bring awareness. I think that's the biggest factor in breaking down the barriers of what MS is and the stigmas that go along with it, and making people see us for who we are and not our disease.
Send money, because we need to find a cure, and that needs research dollars and smart brains to make that happen. So give us all your money. Thanks.
You'll see some of those celebrities right here on the stage this afternoon. So, MS is just one of those invisible illnesses that we will hear about this evening. We'll probably hear a little bit more about that one in particular here, because we have a number of individuals who are actually living with MS here on the panel. However, we also have other illnesses that are not necessarily medical illnesses, but they're also invisible. Those are mental illnesses, and we will hear about persons who are living with mental illnesses who look perfectly on the outside, and the sort of challenges that they have, and what we can do in order to better understand them and better be able to support them as they are going about their day-to-day lives. So here on the panel this afternoon, I have a number of experts who are going to be discussing the invisible illnesses from the various angles where they sit. And the first one, all the way over to my right, is Dr. Rheumatologist de Souza. He's an interventional neurologist at Health City, Cayman Islands, so we thank him for being here with us this afternoon. We also have Mrs. Alyssa Christian, who is a multiple sclerosis patient, and she's also the founder of the MS Foundation of the Cayman Islands. Thank you, Alyssa. We have Ms. Simone Sheehan, nutritionist at the Cayman Islands Health Services Authority. Thank you, Simone. Next to her is Ms. Angella Berry, an MS patient who actually works with me on a day-to-day basis, so she's given me a very insight into living with an invisible illness. Ms. Shannon Seymour, I think we all know Ms. Shannon Seymour is a founder and director at the Wellness Center, and she's been on stage here a number of times talking to us about various mental illnesses. So we're very happy to have each one of them here with us this afternoon. They're going to speak a little bit. They're going to speak about 5 minutes each on their various insights into an invisible illness, and then we're going to give you the opportunity to interact with them. So if you have questions that come up during the time that they're speaking, jot it down. We want this to be interactive. We want this to be a discussion where you can share with us and you can ask the panel questions about anything that you have, any questions that you have in regards to one of these illnesses. So we're going to start over with Dr. Rheumatologist de Souza.
Good afternoon. At the onset, I would like to thank the organizers for giving me an opportunity to speak here today. This is a great forum to talk about disorders like multiple sclerosis and other invisible illnesses. If you look at neurology as a whole, there are a number of disorders which the person will look completely normal but will be going through suffering. Multiple sclerosis is one of them, and other disorders commonly like migraines are also in the spectrum of invisible illnesses. So what exactly is multiple sclerosis? It is a disabling disorder of the central nervous system in which impulses from the brain to other parts of the body get interrupted. Why does this happen? In multiple sclerosis, what happens is the outer covering of the nerve, which is known as the myelin sheath, starts getting destroyed. This process is known as demyelination, and the myelin sheath is responsible for the smooth and effective transmission of impulses, not only within the brain, but also from the brain to other parts of the body. The symptoms of MS are basically dependent on which nerve is getting affected and at which point of time. The hallmark of MS is what we call as relapses, that is recurrent episodes where this demyelination occurs and thus causing the patient to have symptoms. The exact reason why multiple sclerosis occurs is unknown. There are several hypotheses. One is that it is an autoimmune condition, the other is environmental factors, etc. But it has not been proven definitively why people get MS. If you look at the incidence and the people prone to MS, as you move away from the equator, the incidence of MS tends to be higher. MS tends to affect females more than it affects males. It tends to strike in a very young age group, that is about 20 to 40 years. So when people are at their prime, this disability affects them. And MS is not a genetic disorder, that is, it is not passed on from one generation to another. Clinically, if you look at MS, the symptoms of MS vary. They can be very simple, such as tingling and numbness in the limbs, to more disabling symptoms such as spasticity in the hands, legs. Also, bladder bowel issues may occur in patients with MS. The most common presenting symptom is sudden loss of vision, which patients come in with. That is one of the classical symptoms of MS. When it comes to diagnosing MS, it is very, very challenging. Some patients actually go years without a diagnosis being made. It can actually take up to 2 years. That's the average they've shown for a patient of MS to actually get diagnosed. Once the diagnosis is done, the next challenge is the treatment. Why I say it is a challenge, it is basically because of the cost involved in the treatment of MS. In the management of MS, there are a number of drugs which are approved for the management. These are known as disease-modifying agents. These disease-modifying agents are not curative. What they do is they reduce the frequency and number of relapses a patient will have. If you look at the cost of the treatment, it varies from around $15,000 to almost $90,000 per year just for the treatment. Added to that, you have to add cost of investigations such as MRIs, then loss of pay due to missing work, due to relapses, etc. In other treatment aspects of MS, it comes to when a person has a relapse. Sometimes relapse may be minor and the patient may not require hospitalization. Sometimes they are disabling and the patient needs to be admitted in hospital and given a course of steroids. Other treatment is aimed at helping the patient deal with disabilities from pre-existing damage which has occurred. These disabilities may be pain, as we heard in the video. Some people have a lot of stiffness or spasticity. Some people have bladder bowel issues. Depression is another common symptom which we see in patients with MS. Multiple sclerosis is truly one of those invisible diseases because when you see a patient, outwardly the patient may look completely normal. What the patient is struggling with inside, none of us will ever know. And that is the challenge with MS. It is challenging for them to convince their employers also that they are suffering from these symptoms. Many times they're told that they are malingering or faking symptoms just to get sympathy. The challenges for all these invisible diseases, such as multiple sclerosis, ulcerative colitis, Crohn's, is huge. As a society, I think it is our role to be more understanding, supportive. We need to be more informed about these diseases and how we can help people or colleagues who we know are suffering with them. Thank you.
So I'm Alyssa. I'm the founder and chair of the MS Foundation. And as you saw the video, I started the foundation because I was diagnosed with MS. I was one of the patients that took 3 years to be diagnosed. I think I've counted 13 different doctors to receive my diagnosis. At that time, we didn't have a neurologist here in Cayman. Dr. Ramnesh was not here, so it was either a visiting neurologist or going back and forth to the States, which was challenging with young children and work and a family to take care of. So we're really grateful to have Dr. Ramnesh here and to have Health City. It's been a tremendous help for the MS community. So I started the foundation simply because I obviously had the disease, but I was put into touch with a number of people here in Cayman that have MS, which was shocking. And the numbers literally growing weekly, monthly, sometimes daily for us. We're hearing of new patients. So I just felt like there needed to be some sort of outlet, not only for myself, but for all the other patients. So our mission is to provide financial and emotional assistance, not only to patients, but for families. It's not a disease that you're battling alone. Your entire family is affected by that. I speak on behalf of my husband and children. And then to bring awareness, because MS is still, I think, quite a new disease for the public in general, not understanding what it is, having different interpretations of it. So the foundation has been official for 3 years this October. And one of our main sources of fundraising is, hold on. Oh, maybe not. Okay. Sorry. One of our main sources of fundraising is our annual fundraiser called Pretty on the Outside. And it is what it says it is. Patients with invisible diseases don't always look like they're sick. But what's going on inside is a totally different story. And so our fundraiser, the first year we worked with a handbag company, they came down and we had a fashion show, and then we created a bag specifically for MS. And the idea is that me specifically, and I think I speak for most women, we spend all this money on beautiful handbags, designer handbags, and they're admired by people. If you were to look on the inside of those, it's not the case. Usually they're quite messy and we have to clean them out and it's disorganized, right? So that was the idea that we took for our Pretty on the Outside fundraiser. And that takes place every March, which is MS Awareness Month. I think the hardest thing about MS is that no two people are the same. Symptoms aren't the same, story's not the same. And it's really an unknown disease as to why we get it, when we're going to have flare-ups, when we're going to have relapses. You don't get to plan for those. You kind of just have to take it as it comes and hope for the best. And I think one of our biggest challenges, Angela, you can probably help out, but living in Cayman, it's hot, and heat is, for me at least, and I think for a lot of us, one of the worst triggers for flare-ups and relapses. So as lucky as we are, and most of you enjoy being outside, I do not, just because I know it's going to cause days of recuperation. And so there's a lot of quality of life that you miss out on, and getting to spend time with your kids and do all those kind of things. And then I think the next challenge is just communicating, like Dr. Ramnesh said, to friends and family and employers. I think are definitely the hardest, and just getting people to understand. So I just want to say thank you for being here and wanting to learn about MS and all invisible diseases, because it's a very real thing. And anybody who has an invisible disease is, when they communicate it, I'm going to guess that they're communicating it at a fraction of what they're actually feeling. And so just listen and support, and thank you for being here.
Good afternoon. It's a pleasure to be here. So following on from that, I read a statistic this week that said 67% of people with rheumatoid arthritis have reported that they have avoided a certain food or types of foods for some time, or at least at one point in their treatment strategies. And 41% of people with multiple sclerosis have reported that they've used diet modification at one point to affect a change in the course of their illness. So with those types of statistics, we can see that there's a lot of emphasis placed on diet, and it's often something that an individual can feel they can control. A lot of the medications, the side effects, those are things sometimes that you have to live with. But with diet, there are things that you can do to help yourself. With invisible illnesses, which include multiple sclerosis, rheumatoid arthritis, lupus, but there are many more, as Ms. Lizzette alluded to. But with most invisible illnesses, all roads tend to start with planning as closely as you can to having a healthy, balanced diet. Because when you have a healthy, balanced diet, that really is the foundation of wellness. There are many tools available that can help you with planning a healthy diet. Most of us are very familiar with the myplate.gov tool, but there are others, the Eat Well plate, the Harvard Medical School plate, the Mediterranean diet. These are all diets that are all based on, the common healthy messages. But with many of these invisible illnesses, there are a number of extreme diets, exclusion diets that exist that often get used to assist with the symptoms. And the response to these diets can vary very much from person to person, as Alyssa alluded to. Some of these diets are the SWANK diet, the Best Bet diet. These are common diets that are used in the multiple sclerosis management, and Alyssa pointed at the SWANK, gave it a thumbs up because she found it helped her. These are quite extreme diets that require some very drastic changes to the diet and a massive amount of commitment to be compliant. It's a very low saturated fat diet, very, very low, avoiding all red meat for a year, very low fat diet, less than 20, max 50 grams of fat per day. So it's quite an involved diet and requires a massive effort. The Best Bet diet is also one that is quite extreme in its exclusion diet, but it also requires a very severe reduction in red meat, dairy products, legumes, and greens. So by doing that, it means usually you don't end up with very many foods to choose from, and again can create a new set of nutrition problems when you stick with it. There also is some evidence to support for rheumatoid arthritis in particular, intermittent fasting followed by a vegetarian/vegan diet for at least 4 months can provide some relief in symptoms of these issues. A gluten-free diet is often something that is considered as well, and some individuals report some benefit from following a gluten-free diet. There is also the food avoidance diet, the elemental diet, the exclusion diet, the food intolerance diet. Some of those are similar, some of them are more involved in one aspect than another, and again, the results from these sort of dietary restrictions can vary quite a bit. But if somebody wants to follow something like that, who has an invisible illness or has some autoimmune or inflammatory health issue, then we certainly are available to help walk you through how to make that as healthy as possible. There are also a number of supplements that are often pushed onto people with multiple sclerosis and rheumatoid arthritis and lupus, etc. We know that there's a reasonable correlation between low vitamin D levels and the development of MS, and the same with vitamin B12. So often there is a push to supplement and make sure that those levels are corrected. There's a reasonably strong amount of evidence for the omega-3 supplementation, and so that is something that usually most patients with these types of illnesses will benefit from. There isn't a lot of consensus as to what the dose of omega-3 supplements should be, but the NICE organisation in the UK in 2003 made a recommendation of 17 to 23 grams of linoleic acid daily as a supplement. But since then, those guidelines are under revision. With the rheumatoid arthritis, there's a lot of interest in supplementing with antioxidants because of the fact that many individuals with rheumatoid arthritis suffer with low levels of these antioxidants in their serum. Some of the other supplements would be popular would be evening primrose oil, iron, garlic, vitamin C, selenium, the B vitamins, calcium, and general multivitamin supplements. So, you see it's quite a complex issue, and for individuals who want to make these changes, there's a lot of information out there. It's hard to know what's going to work best for you, but if we start with a healthy diet and then we can add and subtract and see how it can help you. So that's sort of an introduction to the kinds of nutrition issues surrounding those specific invisible illnesses that I mentioned. Thank you.
Hello, my name is Angella, and I was diagnosed with multiple sclerosis just over 10 years ago. It's been quite a journey and a life-changing experience that nothing else in life could have prepared me for. I know no one will look at me and think that I am sick. I get all kinds of reactions all the time when I tell people that I have multiple sclerosis. They say, "Oh, but you don't look sick," which is one of the worst things that you could say to somebody who has an invisible illness. Or they say, "Oh, I never would have guessed." Or, "But you always have a smile on your face as if nothing's wrong," and so on. MS is unique to each person, as Dr. Romnish and Alyssa already said, and treatment is not a one-size-fits-all, unfortunately. No 2 days are the same. Each comes with a different experience and its own challenges. There are moments when my body throbs with intense nerve pain and fatigue that I cannot even think straight as MS tries to take control of my body. Most helpful in managing my condition and staying healthy has been my diet over the years. I was introduced to the SWANK diet just after I was diagnosed by a friend who also has MS. And for me, it's not so much as a diet as a lifestyle change. It is anti-inflammatory and mostly gluten-free, with a major emphasis on real foods that are organic, and less on processed foods. So the breads and the cheeses and stuff I try to stay away from. And I am not bothered by gluten so much as some people are. Some people have a very high sensitivity to gluten, some people who have MS and other invisible illnesses. And if you have a problem with gluten, then just stay away from it. Now, I'm beginning to understand why folks in the Bible or from older generations live so much longer. It's all about what we put into our bodies, but that's just my theory. In returning to a natural, wholesome diet, I saw a change in my symptoms after as little as a week, believe it or not. My body started responding differently, and it felt kind of unpolluted, for want of a better word. There was no bloating, less fatigue, less brain fog, and less joint pain. I was able to think more clearly and focus on my work and even sleep better. Fruits, vegetables, lean meats, good fats such as avocados or olive oil are key for me. Hydrogenated palm oil or coconut oils are a definite no-no because of the high amounts of saturated fats they contain. I know that there has been a lot of dialogue regarding the benefits of coconut oil over the years. I'm not here to tell you otherwise if it works for you. I'm just sharing with you what has worked for me and how this particular way of eating has made a positive impact on my health. Meats that contain antibiotics and hormones also have a detrimental effect on my body. Saturated fats are very limited in my regime. Therefore, foods like red meat, dark meat, and full-fat dairy are all restricted. But in this current age, I am happy that there are many great alternatives to dairy out there. My body can tell the difference when I eat something that is not on my list of approved foods, even if I have it only once. I have had the unpleasant experience of not being able to get out of bed one morning. My joints, my legs, and my arms just would not function because I ate the wrong part of a chicken the night before. I have also experienced many days when my pain level is very low because I have been consistently eating well. And my boss will tell you that I have feel fors sometimes that are not very good for me, especially chocolate. There is documented evidence from various recognized authorities that a diet low in saturated fats can have a positive impact on any autoimmune disease, but also on heart disease, diabetes, chronic pain, and even peptic ulcers. I am walking proof that the types of food I choose are key when living with a chronic long-term illness. So, in summary, for anyone struggling with health issues, here's Angella's tip sheet. Focus on developing a diet that works for you. Eliminate processed foods as much as possible and make fruits and vegetables a mainstay in your diet. Pay close attention to the ingredients in your food and not just the calories. Take time to understand your body and how it reacts to your changing diet and adjust your foods accordingly. Keep a food diary. I have a food diary on my phone that is really helpful to me because it can help you to pinpoint those foods that work for you and those that don't. You will see a pattern emerge of how you feel compared to the foods that you have eaten. There are many great apps out there, and I use one religiously, like I said before. But if you don't want to use an app, just pen and paper is fine. Always have your kinds of foods handy so that you do not eat out of desperation. I always have some sort of fruit, fresh fruit or dried fruit or nuts in my handbag that I can always turn to. Follow the advice of your physicians because this is very important. You can still eat and enjoy food, but in a different way that enhances your health and well-being. It will make you feel good. MS or any other chronic condition is not a death sentence, but a life-altering course that takes us on a different journey that we can control. As a dear friend told me when I was first diagnosed, there are hidden blessings in everything, even in MS. Understand that there will be challenging days because I have challenging days even though I walk around with a smile on my face. My husband says, when somebody asks you how you are, don't just say that you're fine because you're not fine. But you know what? I choose to smile. I choose to put my best foot forward, and you can do that too. Thank you very much.
I'm going to switch gears a little bit now and just talk about mental illness. I was really grateful to have been included in this panel. That the recognition of mental illness as an invisible disease, I think, is really telling that we are advancing our understanding of mental illness in our community. And I'm always impressed that there's ways to weave this topic into our National Healthcare Conference. The first thing I want to sort of talk about is this idea of what is mental illness, and one of the reasons why I think it can be challenging for people to talk about or to see in others is because we all have mental health. We all have thoughts, we all have moods, we all have emotions, and those are kind of the three areas that are often dysregulated, dysfunctioning, causing problems in our life if we're suffering from mental illnesses. And so, unlike maybe a physical illness where we're not all feeling the physical symptom, we can all relate to having a bad day or having an irritable mood or having a stressful thought. And so it can be advantageous in that it can let us align with people that have mental illness, but can also create some bias in that it lets us all feel like we are experts and that we should be giving our opinions to people about what works for us. And I think what Miss Angella said about finding what works for you is a very important thing. I was struck this morning by Dr. Warrington's comments when he was giving his talk this morning about the history or the advances of the treatment of mental illness. In the statistics that he cited, that 50% of people, 49 I think percent of children and 51% of adults who are living with a mental illness are not being treated. And I think we'd be quite shocked if we compared that to something like cancer or diabetes. We'd be outraged that people didn't have access to treatment, didn't feel confident seeking treatment, or didn't have the financial means to get that treatment. We certainly see that in the Cayman Islands in terms of some of the challenges of living with mental illness. I think we're doing a much better job in terms of reducing the stigma. We've got organizations now that are working diligently to ensure that there's voices that can be heard, that people feel like they can talk about mental illness. But I just... some of the challenges is that we often have this idea that sort of, oh, I'm really depressed today, or oh my gosh, she's so bipolar. And so we use diagnoses of mental illness in everyday conversations in a way that we don't when it comes to physical illness. We don't say, oh my gosh, I'm having such a cancer day, right? But we do that when it comes to mental illness. And so it makes it difficult then for that person who actually is living with a mental illness to feel like people are going to listen to them or take them seriously or understand that this is actually a debilitating and chronic condition that affects their ability to work, to engage in community, to parent, and to live a full and satisfying life. Some of the other challenges we have are, I think, going back again to Dr. Warrington's presentation, you would have noticed that the treatment often was medication or chemical, but also psychotherapeutic, or some other kind of other intervention besides just a medical intervention. And we continue to have challenges in terms of accessing those services locally because of insurance difficulties. And so I think one of the challenges of living with a mental illness is that the treatment that you need often is not accessible to you. And so symptoms may become exaggerated, conditions may worsen, problems at work or at home grow, and there's a lot of judgment sometimes in terms of how you are or aren't coping, but yet you're not able to access the treatment that you need. We know that our health insurance law mandates that everybody is covered in terms of their inpatient mental health treatment. So if you're ill enough, you'll get covered in the hospital. But if you're seeking outpatient treatment, you want to prevent yourself from being hospitalized, you're capped at $1,000 US a year. And that's not a lot of money. So again, that's one of the challenges. I think, what can we do? What can we do as a community? We can be informed. I think this panel today, I learned things about MS that I never learned. So even just participating in these kinds of opportunities, it broadens our understanding as health practitioners, but also just as members of the community. We can get involved. We can be compassionate. I think when somebody has a mental illness, we often can be cavalier about it. We can be opinionated about it. But to really listen, I think what I heard from Alyssa and what I heard from Angella was that it affects them, and how we speak to them makes a difference in their life. And it's no different with mental illness. It's really kind of taking the time to think about our words, think about our language, and think about the way that we're approaching that person. In our work, we work with a lot of schools, we work with a lot of employers who want to know what can they do to support this person in their office that has an anxiety disorder or has a major depressive disorder or a personality disorder. And those are great questions to be asking. We need to be comfortable asking those questions and to recognize that it's okay if you don't know the answer. We have organizations now like Loud Silent Voices, which has been around forever, that have done a great job in terms of advocating for the needs of our chronically mentally ill patients. We have the Alex Panton Foundation, which is doing remarkable things to raise awareness and funds and access to services. We have the Autism Society of the Cayman Islands, which is looking to educate related to autism and developmental disabilities. The Mental Health Commission, which is gathering data to guide the government in terms of policies and legislation. I'm trying to think if I left any off. These are all organizations. The Special Needs Foundation, exactly, that are doing such a fantastic job with raising awareness and increasing inclusion in our community and recognizing that persons with mental illness and developmental disabilities are all around us. You don't know who's suffering with a mental illness. You could look to the right and look to the left. There might even be people on this panel. There is no marker. There's no physical symptom. You may see things in their behavior, you may see things in their interactions, and unfortunately, a lot of those times we judge character when really we're looking at a symptom of mental illness. So I think being informed is the most important thing we can do, and I think it's quite timely. October the 10th is the World Health Organization Mental Health Awareness Day. And so if you're interested in doing something, then mark that day on your calendar and use it just as a day to educate yourself, to contact a local organization, to do some research on the computer, to talk to somebody that you know that lives with a mental illness. I think there's an awful lot of wonderful things happening in our community, but I think there's an awful lot more that we can all continue to do if we recognize that this is an invisible illness. We don't see necessarily that kid that has ADHD. We see a kid that's bad. We see a kid that's naughty. We see a kid that we don't necessarily want to invite over to our house because they're a handful. But we have to start recognizing that what we're seeing may actually be something more than just the behavior that they're showing. And I think if we can be compassionate and curious and ask questions and be mindful, then we can support the people and the families that are living with these mental illnesses or developmental disabilities a lot more. Thank you.
Thank you all very much for sharing with us this afternoon. And what we've been hearing this afternoon is that invisible illnesses are both medical conditions as well as mental conditions that persons can be suffering from and look perfectly okay on the outside, but they're having challenges and having a bad day on the inside. So it's important for us to understand a little bit more about these illnesses and how we can assist, how we can be a little bit more of a positive influence in these individuals' lives. Now, we do have a number of mics around the room, so while they're getting ready, I'm probably going to ask the panel just to kick off the first question, because it has been said that one of the frustrations of living with an invisible illness is that persons don't understand that you're having a hard time, you're not feeling well, but you're looking well on the outside. And I think both Alyssa and Angela did say that, it's frustrating when people say, but you look okay. So what I would want to ask you would be one thing that you would want to say to friends, co-workers, or your family, one thing that they could do or say that they would be more helpful and supportive, especially when you're having that bad day. Both of you, either of you.
That's a hard question.
It is.
I don't know if there is a right thing to say.
But you just hate when somebody says, you look okay. Because is it because that you feel that they don't understand you? Is it that you feel that they doubt that you're unwell? What is it that causes that frustration?
It's almost like, they're doubting you. I had somebody recently tell me that I was too pretty to be sick. And I went, oh, thanks. I know what she meant, but I didn't take it that way. MS isn't. It just gets you. You don't get a say. It's not. I don't know. It's hard to describe. I don't think there's a certain way.
Yeah, because I think that, when we think of people with disability or illnesses, we kind of think of that individual with crutches or somebody in a wheelchair or somebody who is limping, so we look for some sort of outward sign as to why that person is sick or to explain what's wrong with the person. But sometimes we just don't know what the person's going through. We don't know the illness to start off with. So it's difficult to know what to say and what not to say. So sometimes the person who is saying, but you look well, they're actually trying to make you feel better.
Yes, they're actually trying to give you a compliment, but it doesn't feel like a compliment to you because of how you may be feeling inside. You cannot see pain. Sometimes you can see fatigue, but not always, because for Alyssa and I, stress is a major factor to the detriment of our health. And Lizzette knows this, and she has tried, bless her heart, she has tried to be very understanding when it comes to me and my illness. And she has seen firsthand what MS can do to somebody, And there are times when I am not able to walk. You see me walking around here, you see me running around here, but I'm not always able to do that. Sometimes I literally cannot move. My legs do not work. But I still look fine on the outside. If you saw me, if I wasn't able to walk and you saw me sitting in that chair, you would think that I'm perfectly fine. But that's not always the case. And it's the same thing for people with mental health issues. You don't see it, but it's there.
I think the safest way to go is ask. What can I do? Do you need anything? And sometimes it's just a matter of being left alone. It just depends.
I have a good example. There's a young girl that I'm working with currently, and she's having extremely debilitating social anxiety. And I think we're on about day 8 of not going to school. She feels like something horrible is going to happen if she goes to school, and physically becomes unwell at the thought of it. And there's a lot of people who are telling her she should try harder. And I said to her, and I said to her family recently, I said, we would never say that to somebody who is living with cancer. We would never say, you know what, honey, you just need to try harder to get over that cancer. Or you just need to try harder to manage your diabetes. We would have compassion. We would be thoughtful. We would watch our words. Even if we thought it, we would never say it. But yet when it comes to things like mental illness, depression, and anxiety, and behavioral disorders, we feel very entitled to sort of tell people that they should be doing more or getting on with it. And so not necessarily what you should say, but definitely some things to not say, which are things like, you've got so much to be happy about to somebody that's depressed. Clinical depression is not the presence of unhappy things in your life. It is the presence of neurotransmitters gone haywire that are dysregulating your mood and making you feel terrible, even though you probably do have really nice things in your life. That's the definition. If things in your life are terrible and you're depressed, that's a normal mood reaction, right? If somebody dies and you're sad, we don't call that depression, we call that grief. Clinical depression is when how you're feeling doesn't match what's going on around you. It doesn't make any sense because it isn't something that is caused by your situation. It's something that's caused by your brain.
Dr. Cedar, no, there's a mic coming.
Thank you for the panel for raising awareness about MS. As an orthopedic surgeon, it's very difficult for us to identify a patient with MS after a single attack. The penny drops if they have the eye symptoms. The majority of MS patients that we see as orthopedic surgeons are similar patients who have symptoms like ulnar nerve compression neuropathy, that have neck pain, that have a sense of fatigue. All these symptoms, MS is way down in the list of differential diagnosis. We think of it more in women. We think of it even less in men. MS occurs in men as well as in women, but to a much lesser degree. The only diagnosis that I know of for MS is an MRI scan of the neck, and I would appreciate if I am incorrect or to be corrected. That's the only way I'm able to say that this patient has MS.
It's suggestive of MS. Again, you have to do other tests to confirm it.
Yeah,
like a spinal tap, you have to do the MRI of the brain with the whole spine, spinal tap, blood work, all those kind of things. So there's a diagnostic criteria which has to be met before you can say for sure that it is MS. So that includes the symptoms the patient is having. You have to demonstrate that the patient has had relapses of symptoms. You have to show radiological features which correlate with those symptoms. And you have to rule out other causes.
Well, that's exactly what I'm saying. It's very difficult to put it in a differential diagnosis when there are so many causes for neck pain. So somebody tells me that whenever time I move my neck, I move my head, my neck hurts. That is one of the presentations of MS. The other things that we get as orthopedic surgeons is a Charcot joint. And it's rare to get a Charcot joint is, for example, an elbow where the elbow is deformed, the bones are destroyed, but it's painless to a great extent. Those are one of the other presentations that is rare, but is a presentation of MS, and it's a diagnosis of exclusion. So on behalf of all the doctors that have seen you in the past, I would like to offer an apology. It is not easy to make the diagnosis.
I'll just speak on that real quick. My diagnosis couldn't have gone off an MRI. I didn't have lesions for the first 4 or 5 years. And I had every other indicator. My spinal tap was positive for CSF. I had multiple relapses. I had every other symptom, every other thing pointed to MS. And that's why every other doctor, besides Cleveland Clinic and Dr. Ramnesh, wouldn't diagnose me. And it was very frustrating because they weren't listening. They wanted to diagnose everything else under the sun, put me on all these medications. I refused because at that point we knew what it was. And when I finally got to Cleveland Clinic, I was prepared to start from scratch and do all my tests. And my neurologist at the time looked at everything and said, "This is MS. I don't understand. You may not ever have lesions. There's a small percentage of people who never do, or you may not have them yet." I did eventually get them, but yeah. So it's not easy to diagnose one, and it's not the same textbook for everybody.
Right. Yeah, I totally agree. Thank you.
If I could just say, when I was first diagnosed with MS, I had an episode of vertigo that just would not go away. I could not even stand by myself. And they did every test that they could think of, and I was negative for all of them. So they decided to do a CT scan, and when they did the CT scan, they were not happy with the results of it and wanted to investigate further. So they did an MRI, and the radiologist came back and said, "You have lesions on your brain that are suggestive of MS." That was the only clinical symptom I had at the time, the vertigo, and because I didn't have any other clinical symptoms presenting, when I went away to see a neurologist, they did not put me on any treatment. They said, "You had an isolated episode, and maybe that would be it for the rest of your life." However, a year later, things changed, and I started having more clinical symptoms. So it is very difficult to diagnose. I have never done a spinal tap before. They didn't think it was necessary. Usually that's one of the tests that you do to diagnose, Dr. Ramnesh. I have never done one, but the symptoms that I've presented with just confirm the diagnosis.
Could you tell us some of the adjustments that your family has had to make over the years?
I'm sorry, could you repeat that?
Adjustments. Some of
The
the adjustments that your
adjustments that
family has had to make
your
over the
families-
years.
Like your little dude.
Where do you start, right?
He's looking nice like this. Fluid.
Yeah. It
Well,
depends. Yeah.
it depends. So I was diagnosed 10 years ago, and over the years, my husband prefers to err on the side of caution, and he's afraid to let me out of his sight. That's just the long and short of it, because he's afraid that something's going to happen to me, and he will not be there to protect me or to help me. So sometimes I think that he has put his life on hold, Dr. McGill, for me. And sometimes I think he lives in fear that, oh goodness, what's going to happen next? What's going to happen to her next? Because he has seen me at my lowest with MS. He has seen me in so much pain that I just want somebody to knock me out until it's all over. So he has developed this sense of fear that something's going to happen to me and he's not going to be there to help me or not going to be there for me.
Yeah. My kids have had to learn that I can't take them to football practice because they can't be in the heat for too many hours. Family fun days have to be altered to accommodate me. They've had to be without me for doctor's appointments, or when I'm out of commission. My husband's flying solo with all the duties. Diet, I think everybody kind of has to adjust to that, depending on where you are, what you're doing, if you're at home, if you're out. You always feel like you're that odd person. I can't have that, I can't do this, and I can't do that. So I think it's kind of everything. And then just preparing for what we don't know is going to happen or when it's going to happen, and just being ready for that.
Because anything can happen at any time. We're just a time bomb ready to go off at any minute.
Yeah, you don't know.
Yeah.
Mm-hmm. Yeah, I think speaking from an employer's perspective, I think it's a matter of making sure you understand the condition. In order to be empathetic, you really need to understand. And again, it's going to differ from one individual to the other. And it is just kind of watching that pattern. As they mentioned, stress is a big trigger. I think many of these inflammatory illnesses, stress and lack of rest are triggers. So it's being aware and informed and empathetic. As Angela said, there'll be times that I'll be running her out of the office, at 6 o'clock, at 6:30, it's time for you to go home. But she will say, no, I feel okay today, so let me finish what I have to do today and prepare for tomorrow, because I don't know how I'm going to feel tomorrow. So it's knowing your body and being able to work with the individual, give them time. I mean, there are times when Angela will work until 8 o'clock at night, but then she won't be able to come in until 9 o'clock one morning because she's having difficulty moving that morning and getting out of bed. So it's being able to understand and be empathetic and to work with individuals, if it's coworkers, just to be able to work with them and be able to assist them when they're having a bad day. I think that's really important.
And I think from my husband, especially, is in Angela's too, being a caregiver. My husband's had to give me injections and all the rest because no way I can do that for myself. And I just can't I couldn't, I'm not on that medication anymore, but make the trip to Hell City 3 times a week to be injected. So that was a big thing in our house.
And I had read a statistic this week that individuals who are diagnosed with rheumatoid arthritis, 2/3 of those individuals give up working within the first year. And that can obviously have massive ramifications in terms of the family life, income, if they've been working and so on. So that can add a lot of pressure to a family situation.
Question over there?
Yes, good afternoon. This is for Mrs. Seymour. I was wondering if you could comment at all on potentially what you're seeing in the community as it relates to maybe the increase of substance abuse. Potentially there are a lot of folks dealing with either diagnosed or undiagnosed mental illness, which then they turn to self-medication. You had mentioned the lack of insurance help potentially or programs within the community. I was just wondering what you were seeing in terms of people turning to alcohol or illicit drugs, mainly because of their prevalence and they're not that expensive to get a hold of.
Yeah, I think self-medication is something that those of us that work in mental health deal with a lot. In terms of substance abuse, I think the Cayman Islands, like everywhere else in the world, we've sort of seen various epidemics roll through. We had sort of the influx of the introduction of cocaine and crack and things like that in the 80s, the 90s, and we're starting to see, we've always had lots of marijuana use, we've always had alcohol use. I think alcohol is our most abused substance. We see that amongst our young people. We see that in all sort of socioeconomic status sectors. It's sort of, it's acceptable. It's really socially common for people to talk about how wasted they got and how drunk they were. And so we see the two of them go hand in hand. We know that things like alcohol can increase anxiety symptoms. We know that marijuana use in somebody with a vulnerable brain can trigger psychiatric symptoms. And so I don't know, we could get into the neurology of what comes first, but I think as a mental health professional, we're always wanting to make sure that we're investigating and questioning their use of substances because the two often go hand in hand.
And alcohol is one of the major pro-inflammatory mediators in the body, so it's a known trigger for many autoimmune type scenarios.
This is also for Shannon. I've been seeing a lot more kids, and as you mentioned in your story about the young girl with the anxiety, what would be an age that you start looking at it? Like, where does it change from a toddler who is, maybe just acting out to knowing the fear is real and you should pay attention to it and do it differently? Because I've seen it many, and even in my own home, where it's like, I'll just share a little bit. My smaller daughter will say, I was feeling that way, but I just tried to cope with it, and it breaks my heart because maybe she's dealing with something that you should pay more attention to, but you don't because you're not sure of the age of, what that would be.
Yeah, and I think worries and fears are normal, right? Everybody has them. We all have things that we worry about. We all have things that we're afraid of. And it's common for little kids to worry about the unknown. They worry about getting on the school bus. They worry about lots of things. When does it become clinical? I mean, an anxiety disorder, typically you need to have debilitating symptoms for over a 6-month period, which means that this chronic, constant worry and anxiety has to impact, if you're a child's school, functioning and learning, your interactions at home and with friends, for a period of 6 months. So it's really, it's something that has to be significant in order for us to make a diagnosis. It's not somebody that's kind of like they're worried about something for a few days or they've got a big test or a new teacher coming in. Those are the daily, regular life things, but I think when you start to see things continuing for a long period of time, and from a diagnostic perspective, we need to see significant impairment in multiple areas of functioning for a period of over 6 months, and we need to see the presence of symptoms, which would be rumination, chronic worrying, some of the physical symptoms that go with it, maybe an upset tummy, rapid heart rate, for a period of 6 months. So those symptoms happening more days than not over a long period of time. But we are seeing an increase in anxiety in our young population, and we could talk for days about that. That's something I think we need to start to really dig into and understand, because it certainly is something that we didn't see 10 years ago.
Anyone else has a question?
My mind at rest. Thank you very much. I've just said it.
So sorry.
There's another question up here.
I want to say thank you as well, and also just to ask, what would you say to someone who's in the midst of that the investigation, the searching, maybe has already seen a number of doctors, but hasn't gotten to a stage where they've been told definitively, yes, it's this or it's the other thing, whether it's with mental health or with medical illness. What would you say to someone who's in the middle of that process, who may be getting very, very discouraged and disappointed time after time?
My biggest advice is you know your body and you know yourself, and don't give up until you're satisfied with your diagnosis, with your treatment plan, with your doctor. It's a never-ending journey, and it's going to be something you're battling probably lifelong. So you need to be comfortable with what you've been told and what the rest of your life looks like, and the relationship that you have with your physician, with yourself, with your disease.
I know from experience that it can be very difficult when you're in the middle of not feeling well and being prodded and poked by all sorts of needles. And it can be very frustrating when you don't know what is wrong with you. But don't give up, because you feel so much better when you know that, oh, I have MS, I can do something about it, instead of just wondering what is wrong with me all the time. The uncertainty of it is far worse than knowing for sure. So don't give up. You're not alone.
Mm-hmm. I think as it relates to mental illness, there's a lot about mental illness that we don't understand, and there's actually probably more we don't know than we do know, even though we know more now than we've ever known. And so if you are concerned about yourself or a loved one or a child, to just be consistent, be open, find a physician, a psychiatrist, a family doctor, a pediatrician, a psychologist that you trust. And it can be a journey. We know we work with families where maybe there's a diagnosis of a particular disorder at 7 or 8, and then that changes in adolescence when puberty hits, and it's then it becomes something a little bit different in adulthood. And so it is hard. You have to be patient, and you have to make sure that you've got a team around you of people that are listening to you. First of all, if you're a parent or you're an individual and you don't feel like your team is listening, find a different team. And like these guys said, just trust yourself. You know yourself. You know when things aren't feeling right.
And oftentimes, just to add, sometimes you really need to find that one physician that you trust that will help you find the other resources. Because sometimes if you kind of doctor shop and you go to different specialists and there's no one person with that medical insight and knowledge to be able to piece all of the information together, then you as an individual kind of get lost and frustrated. But if you can find that family practitioner, that general practice doctor who knows you, understands you, and is willing to listen to the wide, array of symptomologies that you're having, and just listen. Oftentimes, that's what you need somebody to do, to listen to you, and to be able to then refer you out to other specialists that maybe can help in that diagnostic process. Anybody else?
And can I just say, don't jump around from doctor to doctor if you don't know, you don't know what's going on. Like Shannon said, be patient. Having said that doesn't mean that you can't get a second opinion, but try to stick with your family physician, because they know you, they know your body, they've worked with you for a number of years, and they should be willing to go the extra mile to help you, and they will. I have met, not just at the HSA, but at the HSA and overseas, and even at Health City, I have met some really wonderful doctors who are really they will go the extra mile for you. They will do what they can to figure out what is going on with you. So just stick with it and stick with them. Trust them, because they are your physician.
Any other questions? Any last words to give to the audience? Dr. Romanesh, would you like to add any final words?
Yeah, so as they were saying, when it comes to the diagnosis of MS, it can take time because there is a diagnostic criteria which has to be met. So if you're missing even one thing, and labeling someone as having MS is also a major thing. So you have to be 100% sure, which is why sometimes it will take time. And yeah.
Alyssa, any final words for the audience?
Just from an employer point of view, I think, Ms. Lizzette, you do a great job of understanding and trying to
Thank you.
accommodate.
Thank you.
Yeah. But I think you're one of very few.
Yes.
And I speak from experience. And I know there are a lot of MS patients and anybody with an invisible disease that have not disclosed to their employer because of the lack of understanding. And there's this, they're in a closet about their diagnosis and they will not share no matter what it is. And they will suffer through it because they're scared they will be viewed differently, that they won't get the promotion, that they won't, be able to succeed the way any normal person would be able to. So just trying to break that stigma, I think that's our biggest challenge now, letting people feel comfortable and safe in any environment, especially the work environment, to be open about their disease with their coworkers and with their employers.
Yeah, that's a very important point, because unless you trust the other individual, even a family member, to tell them what's going on with your body, then truly you're not giving them the opportunity to be able to understand you and to be able to support you. I know, Angela has actually given the example of, when she's traveling, she doesn't want to use a wheelchair because she doesn't look ill, and she's getting stares from individuals who say, but why is she using a wheelchair? What's wrong with her? But again, that also goes, into even families. Families do not want to tell family members of their illnesses. Well, surely if you don't trust the family member or a friend to explain to them what's going on, then they're not able to understand and to be able to support you in the way that you need to be supported with such an illness.
Yeah, and I think that was true for me. I don't know about Angela or anybody else, but I was more concerned about other people's reactions rather than my own. I can deal with that all day long, but wondering how everybody else was going to respond to my diagnosis, that was a whole stress in itself, I think. Yeah.
Simone?
The good news is there's lots of ways to manipulate your diet and lifestyle to help you, as testified by these two ladies today. So there's lots of help that you can receive from a registered dietitian or other professionals. Be wary of some of the information on the internet. As we all know, it can be great and evil all at the same time. And it can be frightening, and the amount, even just trying to prepare for today, I probably have more papers than everybody else on the table, and I'm still confused because it's really complex. So, there are professionals on island and elsewhere that can help you. So, don't worry about contacting us and reaching out. I'm sure we can do something to help you.
Ms. Angela?
Like I said before, nothing can prepare you for being diagnosed with a chronic illness. But that's life. We all face challenges in life. We all are dealing with something. It's a hard pill to swallow, but it's not a death sentence. You can use whatever challenge or illness you're going through, you can use it to make a difference in somebody else's life. And you can live, if not a normal life, you can still live a fulfilling life. It's important to talk about it. We were just talking about finding somebody that you can trust. You have to find that person that you can trust, whether it's a family member, a physician, a friend. You just have to get it out. Somebody who has the same struggles that you do. I have a friend, Renee. Whenever I'm having a symptom that I'm not familiar with, I call her and she says, "Oh yeah, don't worry about it. This is, I've had this before." So it does help to talk about it, and you have to believe in something. Okay, whether it's your faith in God, I am a Christian, I believe in God, and if it wasn't for the Lord, I would not be sitting here with you, talking with you today, because I had some very depressing moments and wanting to hurt myself, But because of my faith in God and my belief that, He will take care of me, I will be okay. So you have to have something that you believe in and something to live for, whether it's your family and your loved ones, for yourself. Just don't give up and hang in there.
Ms. Shannon?
I think become informed. Mental illnesses are very common. They're all around us, so the more we know, the more support, the more appropriate support and help we can offer the people in our community. And I think one of the biggest challenging things for people living with a mental illness is often the judgment that comes with it. The assumption that there's something that you've done, especially as a parent, that you've done to cause this. And I think that does an awful lot to keep people isolated. It keeps people feeling ashamed. It keeps people from sharing and from opening up and to be able to benefit from the support that exists in this great community. And so just become informed so that you can be that supportive advocate to somebody beside you.
Join me in thanking all of our panel members this afternoon for sharing from the heart and being so informative in this discussion. And I also want to thank each and every one of you for being so attentive and so interactive. We really appreciate you spending the time with us this evening. And this ends the session for this evening. Please join us back tomorrow morning. But before you go outside, there will be a coffee break that is kindly sponsored by Hope Academy. Do enjoy the yogurt bars, I think, that's out there. And we'll see you tomorrow morning for the final wrap-up session of our conference.